I think serum testing for hormones in blood is useful. And I normally do this around day 19 to 21 of the cycle if a woman's having a regular cycle. But I also use a test called the Dutch test, which has got nothing to do with the Netherlands and stands for Dried Urine Test for Complete Hormones. And essentially, you pee on strips of card 4 times over the day around the day 21 of your cycle. And this is measuring your estrogen, progesterone, and testosterone, as the serum blood tests would do. It's also measuring your cortisol over 4 points in the day. And this is very important if you're someone who feels very stressed out or very overwhelmed. And cortisol being very high or very low can actually lead to a negative impact on your female hormones. The Dutch test also looks at, importantly, how you metabolize the hormones. And this is also equally important because, especially in hormone replacement therapy, if you're taking hormones but you're not metabolizing them well, then this isn't particularly useful. And then you could be putting your body at risk. And maybe we just need to strengthen pathways such as methylation pathways and liver detox pathways so you process what you're putting into your body better. The other thing it looks at is some organic acid markers for B vitamins, gut health, neurological health, and some neurotransmitters such as dopamine and adrenaline and noradrenaline. So all these things can affect your mood. And of course, if I got a positive marker for the gut health, maybe it would tell me we need to do a bit of a deeper dive in what's going on with the gut and maybe do a stool test to check for opportunistic bacteria, candida, and things like parasites, and also see what's going on with good bacteria. And also look at a marker called zonulin, which can be helpful in seeing if someone has increased intestinal permeability. It also checks for inflammation and blood and other nasties. So all around the GI map is a good test. So I do different testing to a lot of doctors. It's more functional than maybe the conventional testing, but I really believe in the 360 approach and the holistic approach of looking at my patients, and that's why I work in the way I do. It's a proven, tried and tested method, as I've been doing this sort of work for over 10 years and I've seen thousands of patients. So overall, I believe to really achieve total health, we need to not just look at serum markers, but look at things in a more holistic way.